Hello, everyone. My name is Miranda Gonzales, and I'll be your moderator today. I was actually diagnosed 5 years ago at age 40 with hormone positive stage 3 breast cancer. I've been with my husband now for about 20 years. We have 5 children, and I'm based here out of Houston, Texas. Today, we are thrilled to welcome Dr. Bora Lim to discuss biomarkers in breast cancer and what questions to ask your health provider. You may have already listened to Biomarkers 101 and biomarkers in metastatic breast cancer, as well as the broader topic of precision oncology. Dr. Bora Lim is a breast medical oncologist and a translational investigator. She seeks to discover a novel therapeutic strategy to halt or treat aggressive breast cancer and determining a correct target population using new diagnostic methods such as liquid biopsy, single-cell genomics, and proteogenomics. She is a director of translational research at Baylor College of Medicine here in Houston, Texas, and also an associate director at the Lester and Sue Smith Breast Cancer Laboratories. Thank you so much, Dr. Lim, for being here. We are very excited to discuss it and hear all the great things you have to say.
Thank you, Miranda. And then, great to see you and then great to meet everyone who is watching this online.
Great. So we'll just jump right in if that's all right. So the first question I have for you, what are some other words my doctor may have used to describe biomarkers? And is it the same as genomic or genetic testing?
Mm-hmm. Yeah, that's a wonderful question, Miranda. So I am sure for us, who is studying breast cancer and treating breast cancer patients every day, it's a kind of eating food. It's pretty easy for us, and we just sometimes assume that everybody understands what that truly means. I'm sure some of you who have watched the series already have figured it out by now, but basically biomarker is either type of genes or proteins that determine or define what specific type of cancers do you have. So for example, biomarker can certainly include the genomic information. If somebody will say, oh, you have stage 4 PIK3CA mutated estrogen receptor positive breast cancer, there's a true biomarker in that one sentence that you have a certain genomic mutations, but also you have a protein receptor that we kind of segregate them into different baskets and defining them by those biomarkers. Genetics is less considered to be biomarker in older days because we didn't have a drugs to target that specific marker. But nowadays, because we do have a PARP inhibitor, for example, for your genetic mutations, you can clearly also call that as a biomarker. So it's kind of like, when you're trying to send some postcard to somebody, you have to know their zip code, you have to know which city they're living in. So the biomarker is a kind of indicator for us to determine what breast cancer you have so you can actually treat you better. So that's kind of idea of the biomarker.
That's a great analogy. I think that makes it much more easier to understand for us in the non-medical world. For those post-diagnosis, how do I find out what biomarker testing I have had and the results?
I think the post-diagnosis can be in several settings. So let's say I have met some of the patients who have been diagnosed in the other facilities or by other oncologists and came and met for different reasons. Either they're relocating into different city, or they wanting to change the insurance, or they just came for second opinions. At that point in time, I think it's always a good idea to just go over all this information that you had about your cancer. And of course, in older days, your stage mattered more. So like people used to ask me, say, hey, Dr. Lim, what stage of breast cancer do I have? I think in addition to the stage, having this biomarker information, for example, do I have triple negative breast cancer? Do I have a estrogen receptor positive, HER2 positive, so to speak, triple positive breast cancer? And that's important because number one, all of these modern treatments are truly tailored based on what food that your cancer is depending on. And then more importantly, it actually empowers you as a patient. You can actually go to the Dr. Google and then find the right information. So, I know that a lot of us Google everything. And when you do that, if you don't know what you're looking for, because breast cancer is so mixed basket, it's going to be very overwhelming information and getting confused. So I think it has a lot of advantage of doing that.
Oh, yes, for sure. I would never have thought when I was diagnosed that those two things were kind of like the main, I guess, pathways for treatment.
Yeah, absolutely.
For those newly diagnosed, are there any questions I should ask or anything in addition to the standard ER, HR2 testing?
Like I am surprised every day, by meeting my patients and kind of amazed at how smart they are. And sometimes my patients know way more than my doctor friends who are in a different specialty, so they amaze me every single day. It's kind of like they really truly studied. I say those ER, PR, and HER2 is absolutely critical information. As of 2021, where the precision oncology is improving like day by day, and there's a new agent that is coming by FDA approval every 3 months. Actually, I think there are a few other information so you may request or you may try to find from your chart. So number one, I would say there is a marker called Ki67. So it's spelled Ki-67. So it's one of the proteins that is expressed in the cells where the cells are very like highly proliferating, or like I usually tell my patients, it's kind of pedometer of your cancer, where how many cells of yours out of 100 cells have a running shoes on and ready to go.
Mm,
So if you have many of them are ready to like run marathon today, that means your cancer is proliferating fast, which could be another indicator for doctors to make a decision. Like for example, if they have a low Ki67, they might be okay with the pill. If they have a high Ki67, then we may actually offer more aggressive therapy, like a chemotherapy. Somebody who has a early diagnosed disease with estrogen receptor dependent cancer without HER2 or other factors. Actually, some of us actually may actually send the genomic testing upfront to determine which therapeutic routes we're going to go. So
mm.
there are many new, even additional biomarkers that we are going to routinely use. So I think when in doubt, you just say, hey, doc, is there anything else I need to know about my cancer? Are you running any other tests that I should know about? So I think those should cover for now.
Yeah, great advice. Thank you. So for myself, I've already completed breast cancer treatment. Is there any additional testing that I need to undergo as a survivor? Anything that you can think of I should ask for?
I have patients actually sometimes even knock on my door of my clinic or come and see me even after they complete all the treatments. And like, for example, some of them are in that where we call this an adjuvant phase. So
Yes.
after you complete the surgery and radiation, and we are monitoring you, whether without the medication, depends on your molecular subtype over 5 years. And after that, some even go beyond that up to 10 years of taking medications and so on and so forth. Or actually, I have a patient simply have completed everything and just come and knock on my door. I think one of the things that we are discovering in our breast cancer, like some of the other solid tumors, is that there is a new innovation that's happening in the clinic and the lab where we can use, for example, your blood and say whether there's any kind of particles spread from potential hiding cancer cells in your body, even after you completed all of the treatments.
Wow.
Thereby, we think that there's highly likelihood that your cancer may try to come back. So this type of approach have been actually starting to use even advanced than breast cancer in head and neck cancer, or kidney cancer, or lung cancers or colon cancer.
Mhm.
Breast cancer is a little bit hard because breast cancer tends to be like smarter sometimes than other cancers. I don't know if it's because more female is smart. I mean, don't quote me on that, but it is just so smart. So there's a different ways that they can hide and trying to come back and trick us all the time. But I think with the new advantage of the circulating tumor cell or circulating tumor DNA, the blood marker,
Mhm.
maybe the tomorrow's future where we can actually bring and say, hey, Miranda, I know it's been 7 years. Why don't you come back to the clinic? We're just gonna draw one tube of blood from you, and I can tell you like what to do next. So that's kind of our ultimate dream. And I think that actually it might be in the near future. So something like that actually is continued to be developed.
Wow, that's very exciting, especially for us, even 5 years past treatment. If I have a breast cancer recurrent, what should I ask my doctor about retesting for biomarkers?
I mean, I hope that, whoever listens to this video, hopefully never have to deal with that. But unfortunately, that still happens, in quite a lot of patients, because breast cancer just does have this mechanism to survive and come back. One thing we have learned over times is that when these cancers, so there's two ways the cancers can come back. One, because the patient or the person has a higher risk of developing cancer itself. So you got a treatment about 10 years ago, that cancer is completely gone. And now you have a brand new breast cancer, like that is completely different family. So I have, treated a lot of patients like that. So that's one case. The second case is the first cancer, we thought it would kill, we thought the cancer was gone, but some of that tiny little stem cell was hiding in your body. And then 6 years later, they decided to come back and trying to bite you, in your bone or lung and causing real trouble. So those two possibilities exist in breast cancer. Either way, let's say if it was a second case where the previous cancer was surviving and then trying to come back, even in that case, in about 20 to 30% of the time, now they could have completely changed their shape and type. So how you see the crime, movie where the criminals go and kind of hiding and then they ended up getting the plastic surgery, they change their hair color. So then the CIA is trying to find them and they can never longer find them. So cancers do that all the time. So cancers change their nature. So for two reasons, like number one, of course, when you think about the way we treat breast cancer, we give a lot of toxins, radiations, really trying to kill them. So the guys who survived through that, a lot of times they have developed the resistance because, that way they can survive, so they, like, let's say, I'm South Korean. So we say like, you're no longer can have kimchi. I said, oh, okay, well, if you cut off the kimchi, I can survive with cheese. So now I pick a different food. And also depending on so if they say, oh, I-95 is closed, I can say, oh, okay, well, then I'm going to go to 45, then 2 ways to go to the airport. So cancers do that all the time, so that's why it's so hard to kind of treat them. So for me, when the cancers come back, and then of course, if it was a very first case where the completely new cancer had, developed, either way, retesting, recharacterizing your tumor is very, very important. And then I think as of 2021, like 99.9% of the oncologists will do that automatically. But if one in doubt, I think it's always a good idea to demand and ask and check.
How do I self-advocate for the most personalized treatment options? What resources are available to make sure I know all my testing and treatment options?
I think that's very important, especially for someone who, Miranda, you lives in Houston, where there's like every block, there's a medical center and, there's university hospitals. But even within that, I find that some patients' insurance may restrict, which centers to go to. And let's say if you're living in the area where you don't really have a bigger cancer center type of, resources, then it's basically like up to you what you can actually advocate for yourself. So I think a good way to do that is, I think, we're living in 2021 where everything is really like available in your fingertip. Of course, I don't want my patients or anybody to just go online and just like read everything, because there's so many noise rather than true information.
Yes.
However, there is some very relevant and validated, more like well-validated resources. Like, for example, Young, Cancer Survival Coalition is one of them, especially if you're in a younger side of the patient. You may get the, answers and resources that you may not find in any other organizations. The cancers.gov or cancers.org actually trying to provide all this validated, more governmental oriented information for cancer patients. So that could be a good resources. Organizations like Sujanji Komen or BCRF, the Breast Cancer Research Foundations, have a dedicated, web pages that you can actually go and look. Many larger cancer centers also have a dedicated section, so like say if you go to Anderson, Dana-Farber, Mayo, any cancer center with the money, actually they spend some of them efforts and resources and videos also these days. So in my previous institution and current institution, I also created some of the videos for patients. So I think trying to actually have your kind of common sense and figure out like which resources you could actually potentially trust. So I think that's one way. Let's say one in doubt, always don't be afraid to just go for second opinion. Like a lot of my patients tell me, oh, what if my doctor gets upset, if I go and find somebody else? We are all grown human beings. We know that cancer is treating, very tough disease to treat. Always more brain, the better. And also like having just a second, like very fresh set of eyes. So even for me, I consult with my colleague if I have a difficult case. Not that I don't know the answer, but just because make sure that somebody else also look at it and say, agree with me. And I will also consult it through online or simply email or text or phone with my colleagues who calls me about their difficult cases all the time. So we do that among ourselves. Why can't you do that for your own cancer, as a patient? It's your life, it's your cancer. So I say when in doubt, second opinion always is important.
This actually leads me to my next question, which is pretty similar. What advice would you give for someone who doesn't go to a larger cancer center or research institution? I mean, I guess kind of what you said pretty much would apply to that question.
Yeah, I mean, so the thing is, I think nowadays, because breast cancer has been so diversified and then personalized, not necessarily because we have a new drug for the new target, but even within the same diagnosis, depends on how your individual cancer size and how's your individual underlying conditions. There are so many different options that there's a small nuances that experts can really help. So because of that reason, I believe that even the community cancer centers or community practices try to have a dedicated physician who's seeing more of a breast cancer, lung cancer, colon cancer. So many of
Mm,
my patients, thankfully now, are seeing physicians that may not be in the academic center, but who has a personal interest or more deep studies in breast cancer, which is, I think, is a great trend. And many of these community oncologists actually reaches out. So if there's a brand new study that's open, like everything is so new and we get all this like news about it, I get like hundreds of phone calls and texts and emails and say, hey, Dr. Lim, did you see this data? What do you think about this data? I have this lady, 15-year-old, blah, 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 blah. Do you think that I did the right thing? So I think that's interconnected community network is very, very important. And also, I have had a case where my own patient initiated the effort. So she came to see me as a second opinion and basically said, my oncologist is great in many ways, but he told me he's not a breast cancer expert and he feels like he needed help. So after that patient had a very successful treatment, now the physician and I kind of like communicate. If I have a patient who needs a treatment closer to home, I actually refer the patient back to him. He does a wonderful job. And by doing that, his actually knowledge is improving. We form a very great collaboration. So I think there's a lot of things that we can actually initiate both as a physicians and patients.
mm, Very true, yes. And I don't
Yeah,
think a lot of patients realize that they have that power to advocate for themselves when looking around for different information.
yeah, absolutely.
Thank you, Dr. Lim, for being here. We would like to give you a special thanks for your time and your expertise. Everyone here at YSC is very grateful for you and all the great information you provided today. YSC would also like to thank Novartis for their support of these educational programs on biomarkers. We're excited to share the full Biomarker series, which includes Biomarkers 101 and also a session specifically targeted towards biomarkers in metastatic breast cancer, as well as a deep dive into the field of precision oncology. For more info on YSC programs and support, please visit youngsurvival.org to find all the resources you need.